Oh, here is my surroundings and my equipment. I've it all placed. Provider's orders in my MAR with my med card and my patient. And then this is where my computer is going to be. Where you can see everything. Okay. I'm now going to start by gathering my medications and checking with my provider's orders before entering the patient's room. Okay, first what I'm going to do is I'm going to check my provider's orders with my MAR. So, digoxin, I have 0.125 milligrams by mouth daily for congestive heart failure and atrial fibrillation, and that is on my MAR and it has not been given yet. For Lasix or furosemide, I have 40 milligrams by mouth twice a day for congestive heart failure, and furosemide is on my MAR and it has not been given yet. Or Farron or Coumadin, 5 milligrams by mouth daily for atrial fibrillation. Coumadin, 5 milligrams by mouth daily, has not been given yet. And then for my PRN medication, I have acetaminophen 650 milligrams by mouth, only if there's a fever above 101 degrees Fahrenheit. It has not been given. Acetaminophen 300 milligrams or codeine 30 milligrams, aka Tylenol number 3 by mouth every 4 hours for pain rating 1 to 4. Acetaminophen 300 milligrams or codeine 30 milligrams, Tylenol 3 by mouth every 4 hours as needed for pain rating 1 to 4 has not been given yet, and neither has oxycodone, which is oxycodone 5 milligrams, acetaminophen 325 milligrams, or Percocet 1 tablet by mouth every 4 hours PRN with a pain rating from 1 to 4 has not been given yet because I do not want to give those together. Now, with my MAR, I'm going to get digoxin or Lanonix, which is 0.125 milligrams by mouth daily. Okay. I'm going to make sure I have the right patient, which is Joe Smith. I'm making sure that I have the right medication, which is digoxin. I'm making sure I have the right dosage, which is 0.125 milligrams by mouth. This tablet is 0.25 milligrams, but I am going to cut it in half so that it is 0.125 milligrams. And I have the right route, which is by mouth, and I have the right time, as it has not been given yet. Next, I have Lasix, 40 milligrams. I am looking at my, I have the right patient. I have the right dosage, which is 40 milligrams, so I have two 20 milligram tablets, which makes 40 milligrams. I have the right dose, which is by mouth. I have the right time, as it has not been given yet. And then I have Coumadin, 5 milligrams. Making sure I have the right patient, which is Joe Smith, the right medication, which is Coumadin, the right dosage, which is 5 milligrams, and the right route, which is by mouth, and the right time, as it has not been given yet. Now I'm going to get Tylenol 3 or acetaminophen 300 milligrams, codeine 30 milligrams. Making sure I have the right patient, which is Joe Smith. I have the right medication, which is Tylenol 3. I have the right dosage, which is 1 tablet, which is 30 milligrams or 300 milligrams or 30 milligrams. And I have the right time because it has not been given yet. Okay, Okay, now I'm going to scan all of my medication. So I'm scanning my Lasix, my Tylenol 3, my digoxin, and my Coumadin. I am checking the integrity of the package. For digoxin, the integrity of the package is fine, and the expiration date is 06 of 2036, so it has not been expired yet. For furosemide, I checking the integrity of the package, and it is okay. The expiration date is 06 of 2036, so it is okay to give. My Tylenol 3, the integrity of the package is okay, along with the expiration date is 12/20/35. For Coumadin, the integrity of the package is good. It is not broken or anything. The expiration date is 06 of 2036. So it has not been expired. So I will be able to give this medication. Now for my second check, I'm starting with digoxin. I have the right patient, which is Joe Smith. I have the right medication, which is digoxin. I have the right dosage, which is 0.125 milligrams by mouth, and it has not been given yet. To make sure that this is the correct dose, I will be cutting this pill in half so that it is 0.125 milligrams instead of 0.25 milligrams. And then for Lasix, I have two 20 milligrams for my dosage of 40 milligrams by mouth. I have the right patient, which is Joe Smith. I have the right dosage. I have the right medication, which is Lasix. I have the right dosage, which is 40 milligrams. I have the right route, which is by mouth, and I have the right time because it's not been given yet. For Coumadin, I have the right patient, which is Joe Smith. I have the right medication, which is Coumadin. I have the right dosage, which is 5 milligrams. I have the right route, which is by mouth, and I have the right time as it has not been given yet. Now, I am going to pick that up. I'm going to take these to Joe Smith's room. Hi, my name is Danielle. I'm going to be your student nurse today. I am performing hand hygiene and I have provided pregnancy. Can I get your first and last name?
Joseph Smith,
And your date of birth?
10/05/1954.
And do you have any allergies?
Sulfa and betadine.
All right, checking your band, and I'm checking with my MAR. So today I will be administering your medications. Is that okay?
Yep.
Are you in a comfortable position?
Yep.
Okay, first thing I'm gonna do is get some vitals. So first I'm gonna put this pulse oximetry on your finger, and while that is reading, I'm going to get your apical pulse. I got 72 beats per minute, which is in normal range. And I'm going to cleanse my equipment. grab my pencil so that I can write that down. And then your oxygen percentage is 95, which is good. And now I'm going to get your temperature by mouth to ensure that you don't have a fever. Okay, I'm going to place this under your tongue. Okay, that was 98.2. Discarding this. And I'm going to write that down. I'm now going to count your respirations. I got 18 breaths per minute, which is within normal range. Now I'm going to get your blood pressure, making sure that there's no clothing underneath and it is the appropriate size for my patient. First, what I'm going to do is I'm going to feel her pulse, and while I pump it up, where it goes away. Waiting 1 to 2 minutes before I re-inflate. 2 minutes have passed, and I'm going to take my stethoscope and listen. Do it one more time. I got 124/82, which is in normal range. Okay. All right, and looking at your lab values from 2/16 at 10:30, your sodium was 140, which is in normal range. Your potassium was 4, which is within normal range. Your INR was 2, which is in normal range, and then your digoxin from 214 is 1.5, which is in the normal range, and it's not toxic, so I'm able to give your medication. How do you normally take your medications?
By mouth.
Okay. Do you have any pain?
Yeah,
Where is it at?
in my foot.
And on a scale of 1 to 10, how bad is your pain?
I'd say about a 4.
Okay. And what kind of pain is it? Is it throbbing? Is it stabbing?
It's just sore.
It's just sore? Okay. So, do you have any questions or concerns about your medications?
No.
Okay. So, you are taking furosemide and digoxin for your congestive heart failure, and your warfarin is for your atrial fibrillation. And some considerations to remember is that some of the side effects might be nausea, drowsiness, or vomiting. You might have a headache, or we'll monitor your renal function to make sure that all of that is going good. And for your pain medication, your codeine, which is only 5 milligrams. Some normal side effects would be some nausea, vomiting, constipation, and we'll monitor you for an allergic reaction to make sure you don't have any symptoms of that. So what I'm going to do is I'm going to put some gloves on while I open your medications. Okay, making sure that I have the right medication. I have the right patient, which is Joe Smith. I have the right medication, which is digoxin. And for the right dosage, I'm going to cut the tablet in half. And I would properly dispose of this other half as my facility says. For my Lasix, I need 40 milligrams. So I have 2 20 milligram tablets, making sure I have the right patient, which is Joe Smith. I have the right medication, which is Lasix, the right dosage, which is 40 milligrams, the right route, which is by mouth, and the right time, as it has not been given yet. So that's my first pill and my second. And my digoxin is also being given by mouth, as it has not been given yet. For my Coumadin, I have the right patient, which is Joe Smith. I have the right medication, which is Coumadin. I have the right dosage, which is 5 milligrams, and I have the right route, which is by mouth. It has not been given yet, so I'm able to give it with his other medication. And then for his pain, I'm going to be giving him Tylenol 3, which is 300 milligrams of acetaminophen and 30 milligrams of codeine. It is the right dosage. The right route is by mouth, and then the right time. It is the right time as it has not been given yet. If I can open it. There we go. Okay, I have your medications here. And here's some water. Okay. I will stay with the patient until they have taken all their medication, and my patient has. I'm going to clean my equipment with alcohol wipes and properly disposing my glove. Making sure I clean my stethoscope, my and my pulse oximeter. I'm going to perform hand hygiene. I'm making sure that the bed is lowered and locked. Patient has their call light. Patient has their bedside table. Is there anything else I can do for you today?
No.
Are you comfortable?
Yes.
Okay, thank you.